Landmarks for marking the masseter: corner of the mouth and the earlobe. We draw a line connecting those two. Then ask the patient to bite down really hard. And we draw a line at the anterior border of the masseter. I then ask the patient to bite down again, and I'll draw a line at the posterior border of the masseter. I will then mark 1 centimeter behind the front line and 1 centimeter below the top line. And at these lines, I will draw a line drop down parallel to the front line and a line parallel to the top line. I just consider this a no-fly zone where I'm not going to put any neurotoxin. And my target area is in here. There are many variations. I typically will use 1, 2, 3, 4, 5. Sometimes a little bit less if the masseter is not big. And this is where I place my neurotoxin deep, and as I withdraw, I'll put a little bit in using a 1/2-inch needle. So when I do the actual injection, I have the patient clench down, do the injection, withdraw, relax a second, clench again. So as I'm doing the injections, I do have them clench. So I have marked out her masseter. We're going to stay away from this zone and this zone because do not want to hit the risorius. She's got a pretty moderate to large masseter in terms of firmness. She clenches, and so this is for that symptomatic clenching. I've chosen to use 5 injection points, and I'm going to use a total of 30 units. So if you bite down for me, I'm going with a 1/2-inch needle deep. And then as I come out, I'm putting a little bit in. That's 1. And I'm going to go up top, bite down really hard. In. And I'm coming out with a little bit. And then I'm actually going to put a little bit of this in here. Bite down here. I'm deep and coming out, putting a little bit in, and then bite down again. So those are the things you need to know. You need to know the anatomy, you need to know where to inject safely, you need to know how to counsel your patients, and if you do all those things, you're going to be very happy with doing masseter Botox.